And we are back. Welcome back. And Black Maternal Health Week aims to spotlight and address the disparities in Black maternal health. In the United States, hundreds of individuals lose their lives during pregnancy or within their first year postpartum, while thousands face unexpected complications during labor and delivery, leading to significant short or long-term health issues. Here now and sharing more, we've got board-certified ObGyn, Dr. Sophia Lubin. And Dr. Lubin, thank you so much for being with us.
Hi, it's a pleasure to be here today.
Glad to have you sharing with us. And when we talk about Black Maternal Health Week, obviously raising some awareness, what are some glaring things that we can talk about when it comes to Black maternal health?
Well, a few of the things that we can talk about, first of all, is understanding what the scope of the problem is. So the concept that Black women are 3 to 4 times more likely to have a bad outcome or the increase in maternal mortality, 3 to 4 times that of our white counterparts is what's so alarming when we think about Black maternal health. And when we think about things like increased C-section rates for Black women, which also increases the mortality rate, and really understanding that when we're talking about maternal mortality or just Black maternal health, I should say, that we're thinking about it from the time that a woman gets pregnant, the entire pregnancy, and the delivery and postpartum period, which is up to a year after she delivers.
One of the things that got my attention was the statistic that almost 80% of deaths that we see are preventable.
That is correct. Yes.
Where are we going wrong then?
You know, we're always trying to figure this out. However, there are a few things that really stand out. One, medical education and the medical health system as a whole, and the concept of implicit and explicit bias. So at the end of the day, when a Black woman walks into the hospital or in to see a provider, unfortunately, we are seen with a different lens. And we're not heard or listened to in the same capacity as our white counterparts. And that is a major issue and problem. Number two is the fact that, again, the higher rates of things like complications, when it comes to things like C-sections. Oftentimes, we have other complications such as hemorrhage, preeclampsia, and mental health issues that are not addressed during the pregnancy and after the pregnancy. And these are some of the things that can be addressed in order to prevent, increased in complications, bad outcomes, and even death.
Yeah, Black women 3 times more likely to die from a pregnancy-related cause than white women. And there are multiple factors that contribute to these disparities. But when we look at this, I mean, that's quite alarming. And what can we take from this?
Well, what we can take from it is, having a support person. For any birthing person to always go to their appointments with a support person. And that support person can be something like a doula, a family member, a partner. That will help for that person to have a little bit more agency and advocacy for themselves. That's one. Two, addressing things like implicit bias in the healthcare system. So with provider training, and that includes nursing staff, that includes everybody who's a part of the team. And 3, incorporating support people such as doulas as a part of the healthcare team. So that way the patient themselves is always supported and always has a voice. And I think that those are some of the things that will help to start to mitigate some of the issues. But the problem is unfortunately big and vast. But at the end of the day, because of the fact that over, almost 80%, I should say, are preventable deaths, once we start working towards solving some of these issues, then we'll be able to, roll back those numbers.
Yeah. How can the community support during a time such as this, when we look at these numbers being so, glaring? What can the community do to be more vigilant and to possibly even save a life?
As far as the community, that's a great question. I'm so glad you asked, because the more the community is involved in the sense of really supporting the patient, helping the patients to understand that they have agency over themselves, that they can, in terms of just teaching the right language and how to communicate with and interact with the healthcare system, I think is one of the ways in which the community can be as the biggest supporters. Um, the other things that the community can do is by hosting classes, things like um, birthing classes and childbirth education classes, um, so that patients then know what to expect even when they go, before they even go into uh, interact with the healthcare system. The other thing is that if the community can create partnerships with their local hospitals and community centers, then that way the community, the health centers and the hospitals at large will know exactly what issues they are facing from a community standpoint.
So for people who want more information, I know that there's a plethora out there, but where are the easiest places for them to be able to go to?
So there are a couple of different places. Black Mamas Matter Alliance is one. They have a plethora of resources. Sister to Sister here in the Yonkers area is another place that has a lot of resources. They're doing a lot of community engagement. They're working with hospitals in order to help with implicit bias training. And the Earth app, an app that helps, where patients get a chance to go and look at reviews of doctors who have, um, good reviews, or they can, patients are able to go on there and review their doctor, review their birth experience, so that others are able to see who they had good experiences with, what hospitals they've had good experiences with. And I think that those are some of the resources that are helping.
Yeah. Well, I want to let you know, Dr. Sophia Lubin, you definitely helped us out with some information there. We'll continue to follow as well as spread the word. So thank you for being with us.
Thank you for having me.
Of course. And want our viewers to know, if you want more information, please visit the website at drsophiaobgyn.com.